Check. Hey, everyone. My name is Gerard Blanks. I am the CIO at Milwaukee Film, one of your event organizers. For today's Blackbird Symposium, this is the 15-minute sort of alert. We're going to start in about 15 minutes. Now, I get it. Everyone likes to start from the back and then come to the front. But I would suggest, since we're probably gonna have a more intimate crowd today, why don't you come on up to the front? It's like school. Everyone wants to sit in the back of the bus. I get it. 15 minutes and we will get started. Thank you for braving yet another winter storm. I should have put quotation marks, but I won't. Thanks for coming out. We're gonna get started in 15 minutes. All right. Welcome, everyone. Again, my name is Gerard Blanks. I am the Chief Innovation Officer for Milwaukee Film, one of the organizers for today's event. Many of you also know Maureen Post. She is one of the co-organizers. This is the second annual Black Birth Symposium, and I want to welcome you and thank you for coming out. Give yourselves a big round of applause. So before we get started, we've got a lot going on this morning. We've got some conversations, we've got a film, got a lot of things happening just in the morning portion before lunch. So my job is to sort of get you ready for what you're about to participate in. How many folks made it to last year's symposium in this room? Okay, great. See a few folks. So first and foremost, we want to, again, thank all of you for making it out today. Normally, I would be in the bed sleep, and you would have all gotten an email saying, hey, sorry, but we've canceled. Unfortunately, we can't cancel this event. Well, no, fortunately we can't. So it forced all of us to get up, shovel, and get out here. And again, it is appreciated. It is appreciated that you made it out, and so we're gonna make today worth your time, okay? I love starting with this quote. This is from last year's symposium. We had our survey. All of you, do most of you have the Hoover app, hopefully, on your cell phones? There are 2 surveys that we need you to do before you leave today, okay? And you can go in the app, fill out the survey. It only takes a couple of minutes. Last year's survey, Maureen found this quote as she was going through all the survey responses. We actually do read the survey responses, so they're important. And this one stuck out to us. And it was interesting because, and we don't know who this person is, but they wrote, I really hope all the medical facilities get on board with this event. They say that this is the most important issue impacting Black women, but I didn't see everyone at the event. Our community watches to see who puts their money where their mouth is. This also helps build trust in our communities. We don't need another billboard ad. We need your dollars to go to events like this that really make an impact in our communities. We are watching. So that then, for me, is a perfect segue to thanking all of the sponsors who did show up and who make this event possible. Today's event is completely free, from the parking to this beautiful space that St. Gate has provided, to lunch, every aspect. And the only reason we can do that is because we have so many generous partners, many of who are in the room. One of the reasons why we pushed hard to make sure that we could keep this event free is because accessibility is the key to inclusion. It's easy to tell people that you are about inclusivity, but if you're not accessible, you're really not about it. So all of our sponsors, I want to start by thanking the Milwaukee County Department of Health and Human Services, Office of Equity. They came together in a unique collaboration. What was great about it is a lot of times you see departments within institutions sometimes that are fighting instead of collaborating. So it was great to see the 2 of them come together to help be a part of this event and more events going on throughout the year at Milwaukee Film. Children's of Wisconsin and Chorus Community Health Plan. Do we got any Children's of Wisconsin folk here? Oh, they're quiet. They just wave their hands. Okay. All right. You're not as wild as the Freighted folk. We connected with Jacqueline, I hope I'm saying it not right, Whalen through, Maureen connected with Jacqueline Whalen through Professional Dimensions, and she was really helpful in pulling together not only children's support, but also chorus. And so we thank you for your support and we thank you for coming out. Freighted in the Medical College of Wisconsin. Are y'all in the house? There we go. They're always with the woo-woos. And so I always got to start by thanking Heidi Moore, who's no longer with Freighter, but she was one of, she was really the impetus in many ways. We had an idea, and Heidi really helped to push it forward. But Freighter, I really want to thank you. You've been here since the beginning, and so your continued support is, it's needed and it's much appreciated, so thank you. Planned Parenthood of Wisconsin, Tanya Atkins, Linda Neff, Tiffany Wynn, all have been responsible in helping to drive their engagement with this and other events that we do throughout the year. WellPoint Care Network, formerly St. A, they were at the very first Black Birth event, and they've continued to be a sponsor and supporter. So we thank you again for your support. Black Child Development Institute. Wanda, where you at? Oh, of course, perfect timing. She just walked out. Well, Wanda let me know that today, and today only, you can get a free membership. See, just when I call you out, you leave the room. There should be a card on every table with one of these fancy QR codes. You can scan it, go there, and you can, today and today only, get a free membership. Please see the table, and Wanda, yeah, they have a booth outside for more information on all the services they provide, and your opportunity today and today only to get a free membership through BCDI. Thank you, Wanda. And then GE Healthcare, want to thank Lucas Delaney for his advocacy. Lucas, there you go. There's Lucas. Lucas, I believe you will be in the Maternal Research and Technology. We'll talk more about that. Okay. And then last, but certainly not least, the City of Milwaukee Health Department. I want to bring to the stage one of our partners in crime, Erica Olivier. She is the Deputy Commissioner of Community Health for the City of Milwaukee Health Department.
Appreciate you getting my name right. A lot of people call me Oliver, so that's a little pet peeve. Fun fact about me. All right. Good morning, everybody. That was okay. I'll forgive you because I want to thank you for getting here and trudging through the snow. Today was a terrible weather day, but you guys are committed to being here, which is amazing. So shout out to you guys. First, I want to thank you to Milwaukee Lens and Black Film, Milwaukee Film and Black Lens for providing this space to raise up this important conversation. I want to acknowledge Mayor Cavalier Johnson, who, of course, wanted to be here. But I'm honored to represent the Milwaukee Health Department and our maternal and child health programs. But not only that, but the city, who continues to prioritize work addressing Black birth disparities. I want to thank you to everyone for being here and being a part of these very crucial conversations that we're going to have today. It's not only great to bring together community stakeholders and community members in a shared space, but the brainstorming and the action planning that's going to happen here today is completely vital and important to shaping the collective responsibility that we have in addressing Black birth disparities. Many of us have found ourselves in meetings and conferences or forums where these topics are discussed, but we leave without true strategies, trajectory, collective vision, or accountability to really make these changes happen. Today is our opportunity to do that. We do all have a part in the solution, and I really want to make sure that we take the momentum that we generate here today and the passion and inspiration that we walk away with to really create the real solutions needed for this problem. Not doing so would be a super big disservice to the opportunity that we have presented here today. Black women deserve to have safe and healthy pregnancies and birth experiences. We deserve to have our, thank you. We deserve to have our health concerns heard and taken seriously, and we deserve to have our babies to grow up healthy. So with that said, the Milwaukee Health Department has proclaimed maternal and child health as one of our primary focal points and focuses in our strategic plan. So these kind of convening spaces are super crucial for us and imperative for us to gather the important voices and points of view that is gonna help inform our own action planning. As one of the lead sponsors of this event, I really want to stress that we have a deep investment in this work and towards a collaborative body of bringing all these people together and developing what I would consider a blueprint for maternal and child health. I want to thank you again to Milwaukee Film, Gerard, thank you, and Black Lens for bringing us all here today. I want to thank you to all the wonderful speakers and sponsors that are joining us and providing their insight and expertise. And most importantly, again, thank you to all of you. I really, truly, deeply look forward to collaborating with each and every one of you guys to support our Black moms and babies. So, thank you.
All right. So, Kevin, what do we have next? Oh, yeah, the reason you're here, the breakout session. So, this year, for those of you that came last year, you remember it was more of a traditional conference where you had some talks and you had breakout sessions that had sort of, we call them the expert panels, right? And that's great, that's fine. But what we realized is, as we continued to do this work and we met with many of you and talked with many of you, and we had a follow-up event in, September of last year during our Cultures and Communities Festival. What we realized is that a lot of the work that we're hoping to do actually is done better when we're more of a collective work group as opposed to more of the traditional panel talks, you listen. So today, all of you are a part of a work group, a session, right? There will be some facilitators in the room to keep the discussion on track and to gather all the ideas, but you all are participants in a work session. This is not a sit and listen. This is an engage and activate. Everyone good with that? All right. So here are your sessions today. Fatherhood, the Fatherhood Initiatives, Engaging and Empowering Fathers, takes place in the Arc Theater. That is on the ground floor, essentially adjacent to the bar. Reproductive Justice Framework, Movement, and Vision is in Deep Image. All of the meeting rooms except for the Arc Theater are on the 3rd floor. So there will be someone to help guide you to that particular room. We have 2 groups for social determinants of maternal health, 1 and 2. They are in rooms DA 1 and 2, which are connected. There's just a divider. It's up to you all, based on the amount of people that are in those sessions, if you want to combine them, but you certainly don't have to. Today, we're just going to be flexible, okay? So we'll figure things out on the fly. And then maternal health, research, and technology, the one I was talking to Lucas about, I believe we've moved that. That was in method, and Erica will correct me if I'm wrong, but I believe we moved that to lyrical, which is right across the hallway, okay? And then collective work and responsibility now moves to method on the 3rd floor. There's 1 elevator. There's also a flight of stairs, but there's 1 elevator, so you will have to be patient. But all of these groups take place on the 3rd floor, except for the Fatherhood Initiatives in Arc Theater and collective work and, maternal health research and technology, which is in lyrical. In addition to our breakout sessions, we also have some great keynote speakers for today's event. The first group will be our morning keynote conversation with Dr. Tiffany Green and Dr. Jeanette Kowalik. Really excited about this. Some of you saw Dr. Green at our last event. She was amazing. That's why we brought her back. And then many of you know Dr. Kowalik. And this was really exciting because we were trying to get her here for the first symposium, and she's busy. So we were able to get her for this one, and we decided why not bring these 2 dynamic women together for a conversation. And it was great because on Friday we had a prep session with the two of them, and it was just amazing. I was just kind of sitting there for an hour listening to them talk and thinking about how great the conversation is going to be today. That's happening shortly. After the keynote with Dr. Green and Dr. Kowalik, you'll go to your breakout sessions. Breakout sessions will end right around 12:30. You'll come eat lunch, and then we'll do our lunchtime keynote with the subjects from Aftershock. Most of you have seen Aftershock, yes? Yeah, we're gonna have to get the energy going in here. I get it, but all right. So you should have seen it because we had 2 free screenings last night. So y'all got to take advantage. When we offer stuff for free, you got to go get it. Otherwise, we're gonna start charging y'all. But I kid. So Shawnee Benton, Bruce McIntyre, Omari Maynard, the 3 subjects from the film will be here in conversation with yours truly during lunch. And then our closing keynote, Dr. Jasmine Zapata, I think I saw her. There she is in the back. Again, another one that we had to be diligent about because to get on Dr. Zapata's schedule is not easy. So it was a big deal to get her. So make sure you stick around for her keynote presentation. And then after that, I will come up. We have some prizes for all of the people who downloaded the app and have been participating. There's a leaderboard, and you can see where you rank in terms of your participation. There's still time. We have some prizes we're going to give away. And then out in the hallway, we're going to move all the booths out the way, and we're going to replace them with a bar and food. So don't run away. Stick around. You already came out and got this far, okay? So stick around because it's important for you all, for us to network and converse before we go our separate ways. All right? Just a couple more announcements before we start with our first presentation, our short film, Power to Heal. And just so you know, on the table, we have the agenda, okay? So grab that if you need it. A few more things. Milwaukee Film Festival starts in a few weeks, so make sure you grab your passes or tickets and come out to the Milwaukee Film Festival. That is our signature event every year. Cultures and Communities Festival. Again, want to just give a quick shout out to Freighter. They were our first presenting sponsor and really helped get this off the ground. Also want to make sure I give a shout out to Dessa Johnson for all of her hard work in continuing Freighter's partnership with us throughout the year. This year's going to be really big, so make sure you don't miss it. If you didn't see the beautiful shirts on your way in, make sure you grab one on your way out. One thing that I think is really important, and I will remind you of this throughout the day whenever I have the mic, is that this event is a launch pad, right? The idea is we get you all together. Hopefully most of you are engaging on the app. And from this point forward, we build a network, the Black Birth Network. That means we try to stay in contact, we try to support one another's events, and we try to make sure that this event just doesn't become a one-off conference that we can check off our list, and that it becomes exactly what it's meant to be. It's an initiative, it's a network. So grab the shirt if you're a part of the gang. That's how it works. Next week, we have our Diverse Professionals Forum called Engage and Activate. It is kind of what you're going to experience today. We show a short film and we have discussion. Next week's is going to be Women's History Month theme, and so Corey Joe Biddle of the MMAC will be there as host. We're going to, again, show a short film, split people up into groups with strangers, have a conversation, and then we just turn it into a party. That's what we like to do at Milwaukee Film. So there'll be a DJ, there'll be food, all the cool stuff. And then last but not least, and then I'm gonna get off the stage for now, anyone heard a fan of Stacey Abrams? Has anyone read one of her novels? All right, she is a novelist. She's been a novelist for over 20 years. She's written almost 20 books. She has a new book coming out called Rogue Justice, a Thriller. And we were just lucky enough that her team, her publisher, decided pick the Oriental Theater for her stop in Milwaukee. So she's doing a book tour over the next few months, and she's gonna stop by the Oriental Theater, our big auditorium, the main house, and talk about her book and her career as a writer. With your ticket, you get a copy of the book. So definitely come out and support that event. We're doing big things, you know? We're not just a film festival anymore. We do a lot of stuff. With that said, now I want to introduce our film, Poverty Hill. Some of you in here have seen Poverty Hill? Okay. If you haven't, you're in for a treat. Poverty Hill is, in my opinion, it's sort of necessary viewing, especially for people that do this type of work. The film recounts how civil rights activists, the federal government, and medical professionals used Medicare funding to desegregate America's hospitals, medical practices, and medical schools, opening the door to Black Americans in the North and South. The film begins by revealing the culture of segregated healthcare and the real perils it unleashed in Black communities. It follows a chronological arc beginning with federal legislation that facilitated the spread of segregated hospitals following World War II, just as Black doctors intensified their efforts to end racial discrimination. So that first part of the film's an hour long, but there's the first 15 minutes, to me, sum up perfectly why we're here today. I reached out to the producers and said, we're doing, for last year's symposium, I said, we're doing this symposium on Black maternal and infant health. I love the film, but we don't have an hour to show it. Can you give me the first 15 minutes? And they said, not only will we give it to you for the symposium, but we'll give it to you forever. So we own the first 15 minutes of this film, kind of. So I hope you enjoy it as much as I do. We're gonna watch Poverty Hill, and then I will bring up our first keynote speakers. Thank you.
This is the remarkable story of how civil rights activists and the federal government, working together, desegregated thousands of hospitals practically overnight, bringing life-saving care to millions of Americans. This little-known story reveals the role of countless people who never took center stage, but whose shoulders we stand on. For most of America's history, a system of racial segregation dictated every aspect of life. In no area was this more true than in healthcare.
You think about the civil rights movement, you think about housing, public accommodation, education. But I think the story hasn't been told often about what happened in terms of the institutions of medicine. So that's an unrevealed part of the history.
When I was 2 years old, I almost died of whooping cough. Being admitted to the hospital was not even an issue. Hospitals were segregated, as were most hospitals in the South.
I couldn't lift my head, and I couldn't sit up. My uncle came and picked me up. He took me to the hospital. And the hospital said, we don't know what this is, but we're not going to take a Black child that we don't know what it is.
Living was separate and unequal. So that made some individuals and communities sicker than others in the first place. But then once you got sicker, then access to the healthcare system was also unequal.
Black activist doctors such as Dorothy Farabee created health outreach programs that served thousands of Black Americans in the South before World War II. Shut out of white hospitals, Black doctors founded their own hospitals, but limited resources and a hostile government crippled their efforts. Lacking access to mainstream medicine, people in rural communities resorted to home remedies passed down through the African American community for generations.
Only access to health care had been what your parents or grandparents or other people on the plantation knew about things that grew and that they had access to.
In the mid-1960s, while poor people of all races had little access to medical care, segregation made access even worse for people of color.
They didn't have to go to Africa or Latin America or Southeast Asia. We had a third world, including a third world for healthcare in Mississippi. People who lacked food and clothing and shelter, no protected water supplies, having to haul clean water from 5 or 10 miles away, disease, malnutrition, suffering, and their combinations were rampant.
This was a population that had no medical care practically, and many who had never seen a physician before in their life. Women who had 8 children but had never seen a physician.
The system was a feudal system. You would get permission from the person that owned the plantation, and they would give you a note that you could go to the doctor.
A lot of hypertension, and people assumed it was a birthright. My mama had it, so they just sort of waited for it to attack and waited to have the strokes and everything.
These were reasons that life expectancy was so short for Blacks in Mississippi, that infant mortality was so high.
In both the North and South, Black babies died at twice the rate of white babies.
30 to 40% of live births was at home, sometimes not only at homes, but in the cotton field.
We didn't have a nursery, and we just took drawers out of cabinets and put babies in them, you know, and we could put those right by the mother's bed so that we didn't lose any babies or anything.
There was just a little broom closet where they would stick a bassinet, and you had to go and check on your own baby.
They would tell fathers of newborns that they couldn't have their wife and baby back until they paid a certain amount of money.
It was a $125 bill, and I said, I don't have $125. And the lady said, well, we'll just have to keep the baby. And I thought, that's excellent. I'll come and visit him every day. He's going to get fed and taken care of.
In our town, we could not use the hospital. It's called Parkview Hospital. Well, her final pregnancy, my mom was going to need a C-section. The baby was big. Dad went to the administrator at the hospital to say, could she please be delivered there? And they refused. She went into labor. They couldn't get her to the colored ward, so they delivered her at home. And my brother, I'm gonna have a hard time with this. My brother sustained a stroke because of it. That moment is why I'm a physician. It also was the defining moment for me about what disparities really were.
Disparities between Black and white Americans were legally validated by an 1896 Supreme Court ruling that segregation was constitutional as long as the races were kept separate but equal, and they were separate but never equal.
Everything was black and white. There was a black section and a white section. Cafeterias, the hospital waiting area, the rooms, the beds, and everything were in separate parts of the hospital.
Everything was inferior on the Black side, from equipment to the blankets to the room to the painting. It was just clear.
Everyone was on one floor, no matter what you had, a baby, TV, or whatever.
Every time you went into a hospital that was segregated, it It was saying to you that your life as a black person is not worth as much as a white life. You didn't give them titles like Mr. or Mrs. or Miss or anything.
The white patients were Mrs. and the black patients were Perline, Sally, or Sue, whatever.
They used boy for black men. No matter how old they were, you were a boy.
They never got grown. They were just always a child to somebody that was white.
I learned in a difficult way that it applied to me too. One time, 2 state troopers drove up, stopped their car, and jumped out and came over to me. They said, "What's your name, boy?" And I said, "Dr. Poussin." And they just looked at me. And they said, "What's your name, boy?" And I said, "Dr. Poussin." And they said, "What's your first name, boy?" And at that point, one of the policemen put his hand on his gun. My secretary was trembling, and she yanked my arm. She knew the system, and she felt that the next step was that they were going to hit me. And she was probably right. And so I told him, "Alvin." He said, "Good." He said, "Next time you give us a hard time, you're coming down to the station house."
Yazoo City at that time was totally segregated. And one of my jobs as a young person was to answer the back door, which is where the colored office was. There would be someone who was so wounded, they would have to go to a hospital. So they would have to go to Jackson, which was 50 miles away. People routinely died on the trip to Jackson because there was no hospital in Yazoo City that would take blacks.
Segregation made it difficult even to get to the hospital. White-operated ambulances would not pick up black patients.
They had to use hearses. Hearses that were not in use were used as ambulances, and many black doctors reflected on the bitter irony of this because as the hearse plied from town to town like a Flying Dutchman, looking for a hospital, someone who would treat this patient, the patient often died in the back seat of the hearse. Many people assume that segregation was a phenomenon of the South, but it actually wasn't. It was very extended throughout the North as well.
Wherever you looked, you could see the reality of segregation, but there were no signs. Most hospitals in Chicago weren't admitting black patients at all. A few did admit some black patients, usually some segregated part of the hospital. Never put in a double room with a white patient.
Emergency rooms would not admit black people if their quotas were filled, and therefore they were sent to county hospital with a note, "No beds."
Even the wealthiest black patient had to go into the charity ward.
You could have $1,000 bills coming out of your ears, but if the 10% quota at the University of Chicago was filled, you went to county hospital. It was a mob.
If you had no money, couldn't pay, you went to the clinic, you sat there all day. Women with children and babies and crying and hot and all of that.
People were waiting and waiting and waiting. One night I had 20 admissions and 4 deaths of people I had not seen.
For 3 decades, U.S. presidents had tried to expand access to health care.
We have accepted, so to speak, a second Bill of Rights, the right to adequate medical care, regardless of race or creed.
Roosevelt didn't put health care in the Social Security bill because he thought it could never pass. Truman tried to do it.
I've repeatedly asked the Congress to pass a health program. The nation suffers from lack of medical care.
And was just clobbered by the American Medical Association.
The American Medical Association, or the AMA, attacked Truman's health care proposal as socialized medicine. Black doctors and the NAACP supported it. Truman's proposal failed. Instead, Congress passed the 1946 Hill-Burton Act, which provided for the construction and renovation of hospitals throughout the country.
It was a really large financial package that was going to transform the facilities of American hospitals. To get it through the Congress, the legislative process had to deal with the Southerners, and they insisted on a separate but equal clause that would permit segregation in hospital facilities.
What it said was, go ahead,
keep your segregated hospitals in the South, and the federal government will support you and subsidize the expansion of Jim Crow.
Hill-Burton was the only piece of federal legislation passed in the 20th century that had separate but equal written into it.
Best characterized by Grady Hospital, the big public hospital in Atlanta, with one tower for whites and another tower for people of color.
The hospital was built like an H. The two front wings, the A and the B wings, were the white wings. The two in the back, the C and the D wings, were the colored wings. Everything was duplicated. There were two separate blood banks because it was a criminal offense to cross-transfuse blood.
Segregation also made it difficult for blacks to get training to become doctors and nurses, and once trained, to practice.
I came to Grady segregated. I went through Grady segregated. If I saw the class of 1964 white, I wouldn't recognize any of them. We didn't take any classes together.
We entered on one side of the hospital, and I cannot tell you which door the black students entered, but they didn't enter with us. We were not allowed to go to each other's dormitory. I'm afraid that I really didn't get to know any of the black class. The white students had a blue dress.
This is the white student, her uniform, what you see is blue and white, and this is the black student.
Southern states were determined to maintain segregation. They barred black students from attending state medical schools, but paid their out-of-state tuition in exchange for returning home to practice. Many northern schools also refused to admit black students.
I was required to send a picture to Johns Hopkins. I had very good references from significant academic members of the Harvard community. But within 2 weeks, I got a rejection. And my conclusion was they saw my picture.
About 85% of all black physicians were educated at only two schools, Howard and Meharry. Faculty and students at these schools became the hub of medical civil rights activism. After graduation, it was very difficult for black doctors to get specialized residency training.
Most blacks, if they went into a residency, had to train in an all-black hospital such as Harlem or Providence in Chicago, Mercy Douglas, Philadelphia.
Black doctors could not get hospital privileges once they finished their training because they were barred from their local medical society. As a result, they could not admit their patients to the hospital or treat them there. These county medical societies were affiliates of the AMA, which refused to end these discriminatory practices.
American Medical Association had never been a friend of ours.
If you did not belong to the county medical society, you were denied admission. That was the first step of stopping you.
Some of the young docs now, they can't believe. You mean to tell me you couldn't admit your patients to the hospital? No, I couldn't.
Barred from the AMA and refused admitting privileges, black doctors had to find sympathetic white doctors to admit their patients. Many carried a hospital in their black bags, delivering babies at home and performing surgery on kitchen tables. They continue to fight these injustices, forming their own medical society, the National Medical Association, or the NMA, to advocate for themselves and their patients.
A hospital is the workplace of doctors. Who determines who's going to be on the medical staff is the doctors themselves. All the doctors in these hospitals were white. They were admitting white patients, so that if you wanted to charge them with segregation, the doctors would say, well, we're practicing in this neighborhood, we serve our patients are white, this is our hospital. That's the essence of what you mean by institutional racism, right? It isn't something that you can pinpoint in terms of an action. It's built into the structure.
All right, that is Power to Heal. And like I said, it's amazing. I use that film in some of our Engage and Activate sessions that we do with corporate partners. And I always feel like the work that film does in 15 minutes is amazing. So I'm going to remind you that I said we're going to have to be flexible today. Dr. Green is still en route. She's coming from Madison. So that means we're going to postpone the talk between her and Dr. Kowalik until after the first breakout sessions. So all my people that are live streaming, that means your portion will end now, but then you'll get to come back and you'll get 2 conversations during the lunchtime. So we're going to go to our first breakouts now. Again, I want to reiterate, fatherhood initiatives, that session is in the ARC Theater on the ground floor. Josh and Tehran, do you guys know where that is, right? All right. Ground floor, ARC Theater. Reproductive Justice, Framework, Movement, and Vision. The room is called Deep Image, and it's on the 3rd floor. Both social determinants of maternal health, 1 and 2, are both on the 3rd floor in rooms DA 1 and DA 2. They are joined together. Remember, whatever group you attend in the morning, you attend in the afternoon. The morning session is really to ground talk and discussion about the issue, and in the afternoon, we're hoping to come up with action items, potential solutions. We are recording there's going to be an audio recording device in each room. So we'll be able to record all the sessions, and we also will collect any notes. Feel free to keep your notes, but if you'd like, any notes that you write on your Post-it whiteboard or take, we'll also collect, because after this, in the next coming months, we're going to be figuring out how we archive all this information and then give all of you access to it, okay? Maternal health research and technology has moved to Lyrical across the hall, and collective work and responsibility is now in Method on the 3rd floor. Any questions, concerns, anything, feel free to grab me or Maureen, but otherwise, let's get started.